Do you have a better, do you have a reliable pointer? Okay. Oh, the same. Mine does the same. Okay. Someone will if mine doesn't.
David, how's your pointer? Pardon expression.
I got the
I'm sorry, I have a loaded question.
Did I borrow that?
No pun
Thank you.
intended.
You push the handle.
No more
okay.
laughing my
Great.
jokes. Our next speaker
It's hard to see.
is Dr. Daniel Beilin. He holds a doctorate in Oriental Medicine and a master's degree in neurophysiology from UC Davis. Dr. Beilin has been studying biological medicine in Germany for 13 years and has in the last 3 years been scientifically ecstatic about a technology called computerized regulation thermography. And now fully FDA approved for the identification of body and dental foci. Dr. Beilin hosts symposia for teaching of this method, and we'll have the teacher, the leader of thermography coming to San Francisco in late April, Dr. Blum. And now I introduce Dr. Daniel Beilin on thermography.
And where?
You have to move, okay? So
Oh, should I stay near here?
if you can,
Okay.
if you can see her.
Okay, welcome to the new technology. And I'm ecstatic so that I decided to put enough force into this to get it through the FDA, which took about 2 years and a lot of money, but we got a full endorsement from the chief of radiology from the country. So now we have one nuclear medicine radiologist in Texas, which some of you might know, Dr. David Hickey, who's working with us. And we're comparing our results with PET scans and CT scans, and we're finding an amazing amount. And what he said, his quote is, "This thing is extremely reproducible," which puts it in the ballpark for the total acceptance of complementary methods, and should find its way into integrative hospitals within the next few years. So it's kind of like this. It's like right now the amount we have in the States is about 38 machines, and we're going bigger and bigger every month. But it may take a very big leap forward with some, I was just meeting with some potential funding possibilities. And so it's kind of like, I just want to be able to tell you that the price would probably go up $2,000 or $3,000 if that happened, to accommodate the pressure we're going to be under. So you should take a good look at this here, and then make a very serious consideration about going to the seminar that we have at the end of April, beginning of May in both coasts. If you're in the East Coast, we have it in New York on May 3rd and 4th. And then we have it also in the end of April 30th and May 1st in San Francisco. So next overhead. By the way, I just got sent this book. It's about 1.5 inches thick. It's the thesis of a graduate medical student from the University of Stuttgart. And it's called the Regulation Thermographic Investigation of Healthy Patients and Patients with Chronic Liver and Gallbladder Disease, with consideration of the thermic picture of the teeth. And this is one of the many scientific documentations that I'm tearing apart now, because in the United States we like to see scientific studies that prove these things, and this is the one for the liver and gallbladder and the relationship to the teeth. So this is the method. It's called CRT, or Computerized Regulation Thermography. And this slide shows that it's had some history. It started off with actually Dr. Issels, and Frau Issels in the back here has a little bit of a historical story about that, when Dr. Issels was with Schwamm and they were sitting in their, it was in the Tegernsee, right? Which is a really nice resort area that's southeast of Munich a little bit. If you're ever around Munich, you're going between Munich and Salzburg, drive into the Tegernsee for a few days, because it's a beautiful lake area, and you just sit back, have some espressos, and watch your autonomic regulation go crazy. So we have Schwamm way back in '54, and then a few other guys did this other types of infrared thermography. Understand, when you look at infrared thermography, what Dr. Rost, who was working with Issels, they were best of friends, Dr. Rost, still alive, they found that when in their investigations of infrared, their infrared was taking a certain wavelength from the skin. So how do we know how well it corresponds to the biology of the body? Well, they did studies with actual contact thermography and compared that to infrared thermography and found the radiation coming from the body sometimes didn't correspond exactly to what was happening with the inner terrain and the biology of the connective tissue and the capillary beds. And what they found with this is that they had to switch to a contact method. This is called contact measuring, electronic contact measuring, which started in '75 with an analog device. That means a pen plotter that goes like this, and now has evolved to the pen plotter module turned into a computer interface, and now the brains have gone into the software, and they have 8 or 10 doctors that have put their history of all the thermographs into certain patterns and integrated that into the software. So not only do you have a scan of the body, but it integrates in all of the databases from all of these doctors that contributed to this and have been studying this for their lives. And as you may know or not, when the Germans do something, they do one thing for their whole life. And so they get very deeply into these things. And you get them all together in rooms and have big seminars lasting for days, and they make a database that is filled with identification of these patterns of the lack of how well the body regulates in different parts of the body. That there's 3 programs. One program is the teeth, one program is the body, which shows visceral regulation. That means regulation of the internal organs: pancreas, liver, intestine, kidney, adnexa, prostate. And the third program is of the breasts, because the breasts, we know, are very directly measurable by thermographic methods as far as pathogenic changes to the tissue. Okay, next slide, please. So what we do is we have points in these places. This is the picture of the body. And here we have the different body points that are done. So you see the head measurements, and those include mostly sinus. And there are certain head points, namely the temples and the mastoid, as well as the teeth. And there's a book back here I saw that Dr. Arana's group has. That's the identification of mental markers in correspondence with the teeth. And that information is integrated. Oh, there's Dr. Dorman. Hi, Thomas. And that information is integrated. There's a huge correspondence between the teeth and the mind, and there's a psychiatrist in the Bodensee, and Lake Constance, that's integrated all of his psychiatric patients for psychosomatic disease and corresponding it in an index with the CRT thermograph. So some of these are head brain points, and the rest are getting in sinus, lymph. This is the tonsil area, or this is the tonsil, this is the thyroid. It's a very, very accurate measurement for the thyroid, which we don't really have a good accurate measurement for thyroid function. Before I've seen this, we can tell whether we're dosing them with the correct thyroid or with one that they're having some immunity to or lack of reception for. And then we have these lymph in the clavicular area and sternal area. It looks over sort of the chest. And then we have these heart points, which everyone recognizes these from cardiology, and the axial lymph spaces, the hepatic area here with a gallbladder point, and then we have pancreatic points. We can actually identify whether we're looking at the exocrine pancreas or the endocrine pancreas. So it's, you can take old technology like the Vega SEG. Does anybody use an SEG here? And you can also look at the heart rate variability, which is an ingenious device, but it still is a far away view compared to this. So I think that if you want to get into the real comprehensive view of what the body is doing, once you stress it, that's what we're doing. We're seeing what happens to the body once you stress it, and your reflection from the organs to the skin, which is about 80% of the influence of the skin reaction, is coming from the internal organs. They've now identified that in many cases in liver function, in pancreatic function. Here we have intestines, intestinal points, small intestine, ascending, descending colon, and then we have the pelvic points, uterus, ovary, or in the men, prostate, and inguinal lymph. So on the other side we have kidney and then spinal column. Okay, the next slide. So you can see or imagine how these things are connected, but here's a picture of that. And here you see the skin, and the skin, you first make a measurement, and then you subject the body to a room temperature, almost like this room temperature. It really doesn't have to be a cold room at all. And so you can just keep your office temperature the same, and you enact a response which causes a change through the spinal cord, reflects into the organ that's connected to that segment of the spinal cord, and then it returns back to the capillary beds and tells the capillaries to contract or to dilate. And then we measure a second time after a 10-minute period. So the whole test takes only 20 minutes. If you suspect a focus, say in the teeth, you inject Procaine or do how you do your neurotherapy. We can use electric block. And then you wait 5 minutes for that to take effect, and then you retest a third measurement, and you can actually see if, say, the colon on the colon tooth is now regulating properly. Now you've positively identified that tooth focus or not, because dentists might go in and do aggressive things, but it's not connected directly to the problem, and this allows you to see its direct connection. Okay, the next slide. So what we're doing is we're first doing the head points with the person with clothing. We see the best thermographs are done in the morning time, from about 7 in the morning till 2 in the afternoon is the most accurate. But I've done them in tropical countries, turning on the air conditioning just to get it to be about 70 degrees. And you see that then at this point, we take off the person's clothes from the waist up. They should just be in their underwear, and their capillaries start contracting in order to preserve body heat. And there's a shunting of blood to the head, so the head is the only area that warms a little bit. And we conclude the rest of the points in this first drop period, because they have to have their clothes off so we can measure. And then it goes down, and they found that after 10 minutes the body plateaus in a homeostasis. So there's a plateau region. Now you can take your time and measure the second measurement. And that's the new homeostatic level of the how well the body's adjusted to stress. So we know these studies from a long time, from Selye and from all of the people that have studied stress. The Germans said, oh yes, Selye is very right. And they integrated that with their terrain assessments from people like Pischinger and Vincent, and they all work together to understand this other level. In my practice, I use BTA or BEV and thermography and dark field. And I think the three of those are the best marriage for modern biological medicine. They're all objective. Dark field, if you do it right, is extremely objective, but you just have to do it right. So there's places to learn that correctly, and we have now Dr. Bloom, and we're going to also have some dentists, Dr. Ullman, who is the chief of dentistry for regulation thermography, coming in the next year. Okay, next slide. So here we have the ways the body reacts to stress and the ways that the sick body reacts to stress. So here's healthy regulation. You see, you took the first measurement, and the body's at this temperature in that age. And let's just pretend, oh, this is the right tonsil point, which is right here on the skin. And then we allow the 10-minute cooling off, and then the second measurement, it's here. It cooled off, the body constricted in order to retain body heat, and there's nothing wrong with that tonsil. But here, in this number 2, it went up. This is called a paradoxical reaction, because it's paradox to normal regulation. So the body actually heated up when you subjected it to cool air. This is a very interesting physiologic phenomenon, and they've studied this extensively over the last 20 years. They know this, and they've looked at thousands and thousands of patients. I myself have done about 800 patients now and have compared it to mammography and CT results as well as histology and other types of investigative pure science methods. Here we have that it cools down too much. Do you see how this cools down 0.3 to 0.8 degrees? And this is Celsius. And this is cooled down maybe 1.5, and this is maybe 2. Anything above 1.0 is called hyperregulation, where you just touch the body and he overreacts. What kind of patients are those? Those are allergy patients, right? Or environmental toxic patients. So I've been invited to speak with Dr. Ray's group in Texas in the next month. And this will be a very important thing, and this will probably come out in 80% of their environmentally sick patients, is this toxic reaction. And then down here in the bottom is the bad reaction. You see there's hardly any reaction, and this is called the fixed or rigid, and this is the focus suspicion that you see in the teeth, that you'll look for in the teeth in order to possibly identify a focus. Okay, so the next slide is the norms according to Dr. Rost. And what this is it's the ideal man, you know. Of course, the Germans always think about the ideal man, right? So it doesn't exist. But so this isn't a real person, but this would be what we expect everything to be in the most healthy patient. And you'll notice this is the head. Do you see? Number 1, the head. This is the neck. This is the chest. This is the upper abdomen, which includes the liver, gallbladder, pancreas. This is the lower abdomen, which is intestines and pelvis, and this is the kidneys. And you see here in the head, it goes slightly up. See, the red is above the black, but here is where it starts to go down. This is the maxillary sinus, and this is the tonsils. See, they're regulating down. That's normal. But look here. This is the thyroid, because the thyroid is the only organ system below the neck or below the head that actually is kicked into gear to be able to deal with the stress, and so you have a warming on these 2 points in normal thyroid. So we can dose patients who are hypothyroid with thyroid medications, whether it be glandular products or real, say, pig thyroid or whatever type of thyroid you use, or it could be synthroid. And you see that if it's really being received properly and the receptors are intact and they don't need any other synergistic factors like iodine or taurine or something, then you'll have a normal regulation of the thyroid. You can forget about that and move on to the problem of the body. Here you see the chest area, which is the bronchi and the atrium and ventricles, and then actually they have these last ones are for identifying arrhythmias. And then we have the stomach point, which is very much connected to the breasts, as we know through Chinese medicine. And we have the liver, which should come down. You see how all of this comes down in this proper way. And here we have the teeth. The teeth go in this sinusoidal wave. You see this? These are the incisors, and these are the molars on the sides, and this is the upper quadrants, right and left, and up and lower quadrants, right and left. And this is the right breast and left breast. So that's your complete thermogram, where you have the 3 programs integrated together. And then we have this way to discern where to look on this, because this is too complicated. Dr. Rao, how many people have listened to Dr. Rao speak? And Dr. Rao does this first on every single patient that comes into the Paracelsus clinic. But he, up until a year ago, he didn't have the computerized version. He had the analog version that only put out this. And it's very difficult. He became a master at it. He's very, very good. And he learned it in the long way. Now we have the shorter way, where we have something called chaos index, which is CI. Does everybody see that little CI? And this column of chaos, you see, when we stress the body, we want it to be able to do the right things. And if it doesn't do the right things, it's chaotic. If, say, one guy slugs another guy, you want the organ systems to be able to come back into a regulation or come back into their own and heal any little wound and start the process of healing. And this assesses how well the body is able to do that. If there's chaos, it's bad. So if this number goes up to 6, or 5, then we know that area of the body is not regulating. And becomes the most important column of the entire thermogram. So we look at that in the teeth, in the breast, and in the body. Okay, next slide. So we look at the chaos index first, and then we look at a bird's eye view of how thermograms can look. Now look at this thermogram. This is not coming down as much. Remember the one we just looked at, the ideal thermogram? Everything was coming down very well. Like you had a black one and a red one, and the red one would come down. But some of these are not coming down very much at all. See, this one is the same. These are rigid, and these are hyper-regulating. But this is rigid, rigid, rigid. And that's called a hypo-regulating. This is a blocked thermogram. This shows that many enzyme pathways of the body are blocked. There's a deficiency syndrome, and it's kind of a pre-cancer state. It's not a cancer state. It's a shutting down of the regulation capacity. Here is the hyper-regulating thermogram, which is the toxic allergic thermogram, where you have to take people off of all their 2,500 supplements that they take every day from us orthomolecular guys, and you have to treat them very gently with drainage remedies like X-Mikel or the Muc-X Ausleitung, which is detoxification remedies from Sanum Plio. Or you could use, in this detoxification, you could use Marco Pharma, which is Nessman gentle detox remedies. Herbal remedies are very good for kidney and liver. Then you have the worst thermogram, which is called a chaotic thermogram. You see, this is all over the place. This is blocked here, hyper-regulating here. See how it went way down by almost 2 degrees, but here it hardly changed at all. And the whole thermogram looks like this. If you want to know, say, a tumor is removed from a patient, and then they come to you, say, a month later after they've healed from the surgery, and you look at the thermogram and it looks like this. This is a poor prognostic sign. So you integrate this and you try to work on them. So you correct the terrain, you correct the enzyme pathways, you correct the detoxification, and then do another control thermogram, which is about 2 weeks later, 3 weeks later, and then you get them into a better prognostic category. But this would reproduce a cancer, or would produce a cancer within a year or so. Okay, next slide. Here are the teeth measurement points. They're done right at on the skin on the outside, but anatomically this is a see-through picture of where you're hitting the teeth root and where they're joining the gum line. So that's basically where you're testing from. And it's very important that you mark this one that's right before the masseter muscle, so that you can come back into exactly the same point, because with the teeth you shouldn't be off by more than a millimeter or 2. And with the rest of the body, you can be off by a centimeter or so on most of the body points. Next slide. So you see here is the upper teeth and lower teeth, and can you just see the top of this, Marco? A little bit more. Yeah, this is the pathological picture in the teeth before neural therapy. And what we want this to come up in a sine wave. And you see how it didn't come up here. This should be up above the baseline. Here it sort of did. It did. And then let's see the lower one. And this is after neural therapy. And you see that now we're getting on the third measurement, you're seeing the normal regulation. See, we're able to do a third measurement and know if we're doing neural therapy right or not. Okay, next slide. Yeah, this is just a part of our course of how to evaluate a thermogram and how you look for overall rigid. What are the thermal levels? Like, are they hyper-regulating? Are they hypo-regulating? You can go past these next slides into the next one, where it doesn't look like that anymore. Yeah, that one. So in order to see, we started with Dr. Ross' ideal man, and since there's no such thing, a doctor from a high school decided, high school area, and I think it was in Stuttgart, and they decided to take the 437 athletic students. And so they took these students and they did thermograms on them, and here's the average of the thermograms. And you see what the real ideal athletic, well-kept person should look like. And so, and we see this a little bit more clearly. Here are the different segments, and you see this color is normal and this color is abnormal, and these other ones are kind of in between. So we see this is an abnormal color. It means rigidity in the head and the neck. And they found out that this was because these kids were going home and eating pizzas and drinking milk every day. And so they all had some kind of sinusitis or tonsillar inflammation. You can see that here. This little, see how it's going up just a little bit in the tonsil points. But they got an established norm, and that's integrated now into the software. So it does comparisons. And then if you want to put this up a little bit higher, we can see this is the new index, and I'm working with Dr. Bloom, who is the expert, and she wrote the textbook now, on a new index of detoxification ability of kidney, liver, intestine, and lymph function. This is what we call a vitality index, or it tells us sort of like biological age. This should be 3.0. And the enteropathic index, which is the degree to which the gut is having on the pathology. We all know the teeth have a very big influence, and we all know the gut and the lymph system. So this is the gut impact, and that's not very bad. It's a 1 to 6 scale, 6 being the worst. And here we have the lymph system is very bad, see, 4.5, and that's just what we were seeing here. So this is a quick way to assess what's going on here, so it makes it a lot simpler. When you get to be sort of okay at this, like when you pass our course that we do, which is the major piece of all this, it takes 1 weekend only, and then you're off and running. And then you're taking 5 minutes to evaluate a thermogram. You have an assistant that does the measurement, and so you basically do about 2 to 5 per day. And I'm doing about 10 per week. Yeah. Okay, next slide. After that one. Let's just, no. Next one. Oh, this is just an example of what I send you back. What we've organized is that you send me your thermographs, and then you say, okay, well, let me keep on learning, because we all have to keep on learning as we go. We can't just sit in 1 weekend and learn everything. So I help you, and I point to different factors and say what's good, and then I give you a summary and a prioritization of the types of therapy with some treatment suggestions. I use a lot of Sanum. I use a lot of complex homeopathy and trace minerals, fatty acids, enzyme therapies. So it's a kind of a integrated approach, a multi-level, and I occasionally give constitutional homeopathy. So why don't you skip to a couple of these cases, because that one right there, let me see that one. Yeah, no, the one after that. This is a study done by Dr. Wagner, and he decided that he's going to see how well this CRT thermograph works with breast cancer. So he took 63 known cases confirmed by pathology of breast cancer, and then he sent them blindly into a room filled with doctors with mammograms and thermograms, and also with nothing, with just their hands. And so they discovered 34 out of these 63% were confirmed for cancer by clinical evaluation only. 48 out of 63 were confirmed by mammography, and 61 when you add thermography to mammography. So if we add thermography to all of our breast centers right now, we'd be getting this kind of a percentage, about a 96% or so. And there's nothing like that right now. Here, if we drop mammography, And we're tired of the radiation because the truth is that, according to Dr. Hickey, the radiologist, that women are receiving 4 times the dose of a radiograph that they're being told. And they've discovered that some of the beta particles are actually reflecting back on certain types of tissue in the breast that are double dosing the tissue. Okay, so this was an interesting study. Here's some other identifiers to pathology in the breast that we teach in our course. Okay, next one.
Dan, what was the percentage there without mammography and correlation?
It was, 58 out of 63? Now go into a few of the cases. So they're the whole thermographs. Yeah, that one, I think. Next one? No? That one. And let me see the name down here. Oh, okay. This is a patient that comes in with multiple myeloma, and we were looking for, of course, a tooth, because in leukemia and myeloma we have a high incidence of foci in the teeth. However, for some reason I didn't print out the teeth here to identify that, but we found a bad tooth, and we treated her with high enzymes, some antiviral materials, which antiviral herbs and antiviral substances, because there's a high suspicion of multiple myeloma being more of a viral cancer than other types of whatever you want to say cancer is, whether it's a parasite or whether it's just a change in the DNA and RNA. But this type of cancer is different than most types of cancer, if any of you have ever treated it. And she was being watched by oncologists. I work with oncologists, and at this point she wasn't bad enough to be on steroids, and she wasn't really interested at this point, but she was being watched, and it was okay that she does a few other complementary things because she was almost asymptomatic. She had some muscle tension in her upper neck, and she had some pain in her back, but that was about all. Okay, and then on the next slide, this is after we identified a focus, and we had her dentist in New York City that removed a tooth, and you see that she came into now a regulation. See how everything was up the same, it was all blocked, and it was very hot, like she had a fever, but it was blocked, there was no regulation, and now we're getting regulation after we removed the correct tooth. So you can see what your impact is of doing dentistry on the body, and you see what your impact of the teeth is by working only on the body. So that's what I do. I work on the body. I give, say, liver herbs or homeopathy or sanum, and then I see what that does. If the teeth are rigid, and it's very hard, of course, to treat the teeth through the body, but occasionally there is a response, then I refer to, Dr. Nye or one of you guys. So there's also an interesting thing here that you see this color. This is this pinkish color, and it's in every quadrant. It's in every segment of the body, and also in the teeth. And when you see that, that's heavy metal. That's the identifier. Here it's not, but here in every area has. This didn't. But it's a heavy metal identification. It doesn't say what metal, but they've just discovered this after looking at about 20,000 patients. So that's what kind of a database they have. So it's a very academically inclined. As you can see, the readout is kind of very science-oriented. I'm trying to get them and designing another piece of software that'll have a picture of a man, so it'll reconstruct the thermogram on a model of the man. Okay, the next slide.
What type of heavy metals did she have in her?
Well, we can't identify. Oh, did she have? Yeah. I think she had some amalgams left. I think she had a couple removed, and then she had one root canal that was removed right before this. But I think.
Crown on it, right?
Yeah. Okay, this is a hyperactive boy who was called a little bit autistic, very mild autism. And so what we do is we look down this chaos index and we see, is there any organ system that's most abnormal? And you see, this is the chaos index B. That means at the second reading, this is the chaos index A before we started measuring. And the chaos index, and actually the first measurement is here, it's 2.1 in the abdomen, and here it goes up. So that's bad. We don't want chaos to go up. Everywhere else it goes down, 2.3 to 0.7, 2.5 to 2.0, 6.0 to 4.2. And in the head, we see a 0.8 to 1.5, so there's a lack of regulation in the head. And you look at these are points right up in here in the sinuses, and we see this blocked and hot, and then look at this very inflamed sinus point, which can also be a reflection in the brain. So then we look at the teeth. Can we see this over here? And what we see is that we see the 0.8 goes up to 1.1, so we do see an abnormality in the right upper quadrant. And here it's okay, and here is okay, and here it's bad. It went from 1.3 to 3.0, so upper right, lower left. And then we look here, this is the lower left, and we don't see any blocked spots, but here we do. We see 2 blocked spots on the upper right. And he was complaining of headaches on the upper right occiput. So this leads us into being able to prioritize our treatment, and therefore we're not treating, say, the gut, which is so often disharmonious in autistic kids. We're not treating the pancreas, which is also very often a problem. You can see this one warmer liver spot right here than the rest of the liver spots. Here's 3 actual liver points. Okay, so next slide. This is a breast cancer patient who she had a mastectomy here. You can see the other breast is not there. And so you see this big discrepancy in the temperatures. This is the normal one. This one, of course, is because the skin is much closer to the body. But it has established a normal regulation. And these are the teeth. And right here is, so let's look at the upper area right up here first. And here we see on the upper right quadrant, it goes way up. Is that 2.7 right there? And so it went from 0.3 to 2.7 with a high degree of block or rigidity here. That's a highly suspicious area. So then look down here. And here we see some blocked areas here. So we had, I don't know, is David Nye here? Okay, well I told him that he should look at this, and so he looked at this, and sure enough he found a huge cavitation here in this blocked area. See, these 2 points are very blocked. He tapped it and found a huge cavitation, and even he couldn't see anything on the x-ray. And this patient is absolutely healthy now. She was also to Dr. Rao, and he agreed there was something here. So we see very nicely on the next thermogram that these areas are now moving, they're now regulating. This is the second thermogram after she had had the dental work done. And so a lot of the stress factors are now removed, and she did a kind of a silly thing. She was very, very healthy, and her oncologists even agreed, but they thought, well, we should just do a little bit of chemo anyway, just to make sure. And she even though her energy was great, this picture was great, all of her x-rays and all scans were great, but she wanted to do it now, so we're just building her back up now from the chemo. So that's all we're doing with now. And hopefully she's still strong enough and doesn't develop a new focus after the chemo. Okay, next patient. There's the patient. Oh, okay. This guy had bladder cancer, and he was a smoker. Maybe 15 years ago he quit. He's also a medical doctor. And he had nothing overtly wrong at this point, and so I did a thermography with him, and he had received BCG for the bladder cancer, which is done it's done by a cystoscopy, and then just a introduction of BCG, which is apparently extremely effective on bladder cancers. And then what they did was they actually made a mistake and invaded the epithelial lining and got it into his bloodstream, and he came down with a tuberculosis of the blood and almost died from malpractice. So he's an MD receiving malpractice, which is something that has turned his stomach away from medicine, but he doesn't need to practice anyway. And we found a tooth, I think it's right here on the upper right. No, what's this number here? 5.6. Yeah, this is the upper left. So I said, this is the worst chaos. You see that? So we looked in the upper left, and I said, you've got something right here. Do you see how this point is getting very rigid where everything else is regulating normally? So he says, I didn't want to tell you this, but I've been having pain right there, and I'm going to my dentist next week to check it out, but I've been having pain. And sure enough, there was an abscess, and he said, just pull the thing. So I think basically through the BCG and through removing the focus, this guy's going to be in good shape. His regulation is good, even though it's hyper-regulating. This is still after that huge episode where he almost died from wrong introduction of BCG. BCG is a great thing if you use it right. Okay? So I think that kind of gives you an idea of how well we're able to visualize this. And what I'm finding is I got so enthusiastic about this because it seems to reveal more and more. And then when Dr. Bloom comes, or I go over there, she's coming at the end of April, beginning of May, and be sure to pick up one of our brochures about when it is and where it is, and fax it to us if you'd like to come. Every time I see her, I learn like about 10 different new gems from her about how to identify pre-cancers, which can be supposedly viewed up to 6 to 7 years before they become macro malignancies that are identifiable by any other method. But we don't want to claim that, and we can't exactly claim that at this point. We've been given certain constraints by the FDA that we can identify these things, but you can't make these huge claims, see cancer way before it happens. We still need more, gathering studies, but it's very, very promising. And the software is growing. Every 6 months there's a new little addition. So we're all working hard to make this bigger, and I'm trying to form now a company that's going to be doing R&D in the back room, and we'll be developing it like in faster stages. So I thank you all for coming. Please come to our booth and sign your name so that we can inform you about our different therapies and different programs. Dr. Harada?
Have you been able to check your thermography with a person that is sleeping or in a geopathic stress zone area and you're moving from this area?
Yeah.
Can you document those changes with the system?
The person that turned me on to this was my old friend who was the right-hand man of Helmut Schimmel. His name is Dr. Reimar Bonnes in Stuttgart. They just, he and his wife, she's a gynecologist but does Chinese medicine, have been using thermography, and they said, you've got to use this, Dan. They said this 3 years ago. She has become one of Germany's expert lecturers on geopathy and thermography because they've identified the pattern, they believe, of geopathy. And what it is it's that there are a lot of hot, the baseline is low where most of the thermogram appears warm. And there's also markers in the teeth that reflect geopathy very, very accurately. So, and I have had patients where I've they've gone on vacation for 2 weeks and they just come back to my office and their thermograms look very, very good. And 3 weeks later, they're not anymore. So the material is there, and if you'd like, I could get you some of these formulas for it. But they are thinking in those terms, and they are gathering the data on that already for a couple of years now. Yeah?
How about using this thermography for evaluating the effect of the bite?
The effect of the bite. Well, what you do is you say you have an appliance and you want to see whether it's okay for your regulation system. And this is in Dr. Bloom's book. What you do is you do the thermogram and then take off the appliance, wait 10 minutes and do a third test measurement. And you'll see the change. We did this just now in Florida with 2 doctors I was training. And we found that it actually helped half of the readings and hurt half of the readings. And we could pinpoint which ones it was helping and hurting, so we'd know how the appliance should be modified. So it was very interesting. I haven't done much of that. Yeah?
Second question, you didn't show us the teeth of the healthy athletes.
Oh.
I would like to see the
I don't know whether he did that. I have to ask them. I've never seen that.
I watched the slalom on the Olympics, and I see that, young Swede, and I see osteoporosis of the jaw, basically. These people are so acidified, these younger people who are putting out that kind of effort, but they're catabolizing their bone, and you can see it in the recession of their gums, and I'm just kind of curious. I might like to see it go back.
I'm not sure that he did that in
to
the
the
study,
ideal
because
model.
I've never seen it in any of their papers that talk about that study. Or
The BTA does the same thing. It takes these, young people and says, these people are
Yeah,
healthy.
yeah.
And I'm just curious what your take is on that.
I don't know. I'm not a tooth person. I send those to the teeth people, but I don't know about athletes and how their bones are. I would assume a lot of chemistry is different about real Olympic athletes, because they, just take women who run. You can see how sensitive the body is to severe exercise. So I think it causes a lot of different changes that are almost pathological in themselves if they're done to the extreme, like Olympic people. You had a question over here? No? Okay, well, we're going to lunch, aren't we, Chris?
Yes, sir.
Another nice job.
Thank you. Thank you for having. Yeah.
Very good. Very good stuff. We have 2 more lectures this afternoon and one tonight at 8 o'clock in here. There'll be some more thermography discussed, and in fact, I'm talking about it some tomorrow also for my lecture, so we'll do a little bit of thermography this weekend. Great tool, great way to diagnose the autonomics. So we'll take a break for lunch. Be back at 2 o'clock for Dr. Kunow. Lunch is on your own today.